Hi, I'm Stephanie, and today I will be talking about the Medical Scribes Training Institute's online General Scribing course. The General course is the first course that any new scribe will be required to take, as it covers all of the basics of work requirements as a scribe. You might be taking just the General course, or you might be taking the General course and a specialty course after, like if you're working in an ED, or a dermatology office, family practice office, or somewhere else that requires specific information beyond the general course. First, you'll click on the General Scribes course. This will be the foundation of your learning, so it's important that you start here before doing specialty courses. You'll start with your course welcome and watch a succinct, informative 2-minute video on how to navigate the course. You might feel you know a little or a lot about different clinical settings, but the first short 6-minute video breaks it down easily into inpatient versus outpatient settings. You also get quizzed after every section of the lesson, and it's very important to remember the questions on these quizzes because they're not only vital to your practice, they're going to be vital to passing the course. By understanding the roles of different clinical care team healthcare professionals, you can walk into your first day as a scribe prepared to see what every person does in their clinical settings. There's such a diversity of healthcare workers, so it's actually very fun to see what kind of careers are out there. Feel free to get to know the entire clinical care team, beyond just the physician or PA or NP that you scribe for, to gain a greater understanding of clinical care. You will have a quick training on what electronic medical records are, since this is the actual electronic system that you will be using as a scribe. You'll get to know these very well. The more you work with medical records, the easier they become to understand and navigate, so don't be intimidated at first. Just take good notes on what to remember about the system and be willing to learn. You will briefly learn about the duties and scope of a scribe, as well as professional norms expected from you. While there is a section on medical coding and billing that you should pay close attention to, these tend to be background information unless your provider specifically requires you to fill in codes on the chart. Sometimes the provider does this themselves, and sometimes they ask the scribes to do it. This might be a skill that you develop later on, after first mastering fundamentals and medical terminology. Your terms section will thoroughly cover everything you need to know about breaking down medical words. Beyond learning your abbreviations, you'll next learn about anatomy and physiology, or pathophysiology, because this is going to be essential no matter what healthcare setting you go into. This section is interesting and important for a new scribe, especially if you haven't taken anatomy and physiology before. If you have taken A&P, this section might be more of a review for you. However, it emphasizes terms you'll always see, and you'll most often see in a clinical setting, so just pay attention. Do not feel nervous if you have not yet taken an anatomy and physiology course. MSTI covers all of it. Each system gets covered in about a 3-minute to 10-minute video, and you also have individual pathophysiology videos highlighting the most common disease processes associated with each of those systems. Most anatomy classes do not teach you about medical abbreviations. Abbreviations can be very common and useful when creating a quick, accurate medical chart, and you must ensure that you do not mix up or confuse abbreviations. If you ever question yourself, my advice is to Google the abbreviation to double-check its meaning or to ask your provider. This abbreviation section is very helpful for your early days as a scribe. The medical chart overview section is probably the most important information, as it all is directly relevant to what you will do as a scribe. And more than likely, unless you've worked in hospitals or healthcare administration before, you will be unfamiliar with this certain structure of medical charting. So what does it go over? Well, you'll learn what a SOAP note is. Essentially, subjective info, objective info, assessment info, and a plan made by the doctor. In each of these sections will be areas where you chart. There will be a brief touch on diagnostic tests showing you the very fun side of scribing. You'll dive into depths of medical decision-making, which includes the doctor's plan of action for a patient and a few coding measures. After, you try out a practice scenario, where you get to type at your own pace. It is great practice. Finally, you'll finish the course with an overview of the most commonly used pharmacology or medicines across all practices of medicine, a review of HIPAA, and the end-of-course exam. On the end-of-course exam, you must get 80% or higher, or you will have to retake the exam. Remember, reviewing the quizzes throughout the lessons will really help you, and you might see some quiz questions reappear on the final exam. Overall, the general course is a wonderful refresher for any type of scribe. It contains real-world information that you will use in your work. Even for me, a long-term AD scribe who has worked for nearly 2 years, taking this course was a refresher in some basic pathophysiology that I had forgotten. Especially if you go into a specialty, refreshing your knowledge on general terms, medicine, and fundamentals will make you a better scribe and a better future healthcare worker. By reviewing your fundamentals, you won't find yourself pigeonholed into only knowing one type of specialty. At the end of the day, this is an opportunity for you to grow because a lot of providers enjoy teaching scribes and letting scribes learn on the job. When they know that you're determined to go into the medical field, they like to walk you through medical diagnoses, differentials, the medical decision-making. Often, they even teach you how to read EKGs or X-rays. By coming prepared to your scribe job, you'll have the chance to make lasting connections. You can get more out of your work than you ever expected. Good luck taking the General Scribe course, and feel free to reach out to Medical Scribes Training Institute with any questions.